department. You're welcome to the first webinar session in the month of June, and we appreciate your presence this morning. I'd like to acknowledge the presence of everyone who is on the call right now, our esteemed retirees, members of ALAOPS, the Association of Lagos State Retired Heads of Service and Permanent Secretaries, and serving officers who are on call. We are presently just 23 on the call, but we will just go on because of those who have joined earlier. Our topic for today is understanding peptic ulcer disease. But before we start, I'd like to call on our director, the Director for Service Department, Mrs. Durodola Olushola, to kindly declare the webinar session open.
Okay.
Okay.
Okay. So good morning, distinguished participants on this call. I'd like to see acknowledge of the house, particularly is Butu Ashe, who was also one time a honorable commissioner in the state. I welcome you all to this call. As we have been told this morning, we are going to be having a discussion on understanding peptic ulcer disease. And I want to believe that is a topic that the elderly should be interested in. You know, with age, some of us may be experiencing body pains, and that may result in us taking certain drugs over a long period of time, which may eventually result into medical conditions like ulcer. So this morning, I want to believe that our facilitator will talk on drugs that could worsen or cause peptic ulcer, and then advice on probably diets and what we can do to reduce the effect of the pains that some of us are experiencing. So on that note, on behalf of the head of service and the permanent secretary, public service office, who are both unavoidably absent this morning, I would like to declare this webinar open. Thank you all very much for your presence. So over to you, Mrs. Ruland. Please go ahead.
All right, ma. Thank you very much, ma'am. Our facilitator for today is Dr. Chikadibia Hamzat. She's a passionate and committed healthcare professional with a strong focus on preventive medicine. She is currently with the Lagos State Public Health Space, where she delivers quality care while actively promoting health education. She is a graduate of Igbinidion University with an MBBS degree. Dr. Hamzat has cultivated a keen interest in women's health, particularly in the area of reproductive medicine. Her dedication to advancing sexual and reproductive health was demonstrated during her tenure as director of the Standing Committee on Sexual and Reproductive Health, including HIV and AIDS, SCORA, which was from 2019 to 2022. While performing this role, she led impactful awareness, advocacy, and education initiatives at both local and national levels. Dr. Hamzat seamlessly integrates clinical practice with community outreach, continually working to enhance health outcomes for women through early intervention, advocacy, and patient-centered care. Dr. Hamzat, good morning, ma'am.
Good morning. Good morning, Ma.
Good morning.
Good morning,
Yeah,
everybody. Good
welcome.
morning.
Thank you.
Thank you so much.
So over to you, please.
Okay, so let me quickly share my screen. Thank you very much for having me on this webinar. It's really a pleasure to be here, and I hope that after this, we'll all understand peptic ulcer disease and dietary modifications. So let me quickly share my screen.
Okay, no problem.
So today we'll be talking about understanding peptic ulcer disease, and in this topic, we're going to discuss the causes, the symptoms, the complications, prevention and management, which includes lifestyle modifications, medication, treatment options, and most importantly, dietary considerations, that is the foods to avoid and the recommended dietary habits for people living with ulcer. I would also be demystifying peptic ulcer disease. So the common myths that we know about peptic ulcer disease, I would be sharing them and actually telling the truth about them. So let us start. So peptic ulcer diseases are sores that are found in the inner lining of the stomach. So the stomach is covered by a mucosal lining the stomach through the small intestines, and ulcers are when the acidic content of the stomach or some other outside factors eat away that lining, creating an injury. Like this picture that we're seeing here, can you see the second picture after the introduction? There's an opening there. That's a sore. That is a typical look of an ulcer.
Hello,
That's what it
doctor.
looks
Sorry
like
to interrupt.
when you do.
Hello, Dr.
Yes.
Chika.
Yes,
Please, can you
I
be
can hear
more
you.
audible? Because your it's not so audible. It's low.
Okay. Can you hear me now? Is it better?
Yes, I think it's better. Yes, it is.
Okay. So I'm saying that if you can see the picture here, there's an opening there. This was taken while this patient was undergoing an endoscopy. And this is a typical visual representation of what an ulcer looks like in the stomach. So this is how the stomach lining is. The mucosal lining of the stomach looks like, and this is a typical picture of what an ulcer looks like. So it's just like an injury, a small opening that the acidic content of mucosal lining of the stomach leading to the causes of ulcer. So like I said, the mucosal layer of the stomach is a protective barrier for the stomach. Can you hear me? Am I very audible?
Yes, well, it can be louder, please.
Okay, sorry. So the mucosal layer of the stomach, is that better now?
Go ahead. We'll just listen.
The mucosal layer of the stomach is a protective layer of the stomach. It's a protective layer of the stomach that protects the stomach from outside, that protects the stomach from factors that affect it and all these acidic disruptions. Then, so there are two major causes of peptic ulcer disease. We have the Helicobacter pylori, which is gotten from food, infected foods and water, drinking water, and drinks that we buy outside. So if we patronize outside vendors and we eat food that is not properly cooked, this bacteria is found mostly in those foods. It can also be passed across by kissing, sharing cups, spoons with infected people. So once this happens, we now have the Helicobacter pylori germ, which enters into our bloodstream and goes to the stomach lining and embeds himself into the mucosa of the stomach, thereby creating irritation, which can later now lead to an ulcer. That is one major cause. The second major cause is what a lot of people are very, very used to. People take pain relief like NSAIDs. NSAIDs are numbs the lining of the mucosa layer and cause ulcers over the long run. So those are the two major causes, but there are other causes which are excess gastric acid secretion. So when we get hungry or when we eat food, there is acid that is produced, known as gastric acid, is produced to digest the food that we have eaten. Now, if this acid is in excess, this acid usually eats up the layer of the stomach. That's why it's always good to make sure that something is in your stomach at every point in time. You eat regularly. Because when this acid becomes too much or is produced in excess, it will continue to erode the mucosal layer, which is a protective layer of the stomach, and then cause an ulcer. We also have physiologic stress. Under physiologic stress, we're talking about serious illnesses, severe burns. So people that have undergone severe burns, they could come down with ulcer. And then we also have genetic factors, family history. So if there's a family history of peptic ulcer disease, there could be some genes that are responsible for this peptic ulcer disease that runs in families that are passed down from parents to their children and so forth. And then when you have a family member that has ulcer, it is possible that you could later get ulcer along the way. Yes, possible. So because some people might not actually come down with ulcer, but some people might. So now symptoms of ulcer. I categorize them into three different symptoms. So we have the initial, those are symptoms, and then we have following symptoms, which come after you must have felt the initial symptoms, and then we have the critical symptoms, which now means there is a problem. This ulcer is now getting too far. So the initial symptoms include burning or gnawing pain in the stomach, often between meals or at night. So when you feel some type of churning pain in your stomach, very painful, and it's always felt around the epigastric region, that is slightly under the chest, in the center of your chest, just under there, the soft part under there is where you feel this pain. And sometimes this pain radiates to the back. So you might feel a sharp pain or a pain that you cannot really explain, that it just feels like churning just around that epigastric region, reaching your back, and sometimes you feel this pain going to your back or the tip of your shoulder. That is a typical pain for ulcer, and you can feel it especially at night, but you can also feel it in between meals. Okay, so gastric ulcer pain may worsen with food. There are two different types of ulcer. We have the gastric ulcer when the sore is found in the stomach, and then we have the duodenal ulcer when the ulcer is in the small intestine, in the upper part of the small intestine. There's a picture that shows that at the top. I will go back to it. This part that shows small intestine, that part, once the ulcer is there, it's called a duodenal ulcer. And when it is seen in this part of the stomach, it is called a gastric ulcer. So with gastric ulcer, the pain worsens with food. So when you eat food, you feel more pain after eating. While in the case of duodenal ulcer, you feel the pain, but when you eat, it gets better, but returns a few hours later. That is probably when the food has digested, and then the pain will come back. And when you eat again, it gets better, and just like that. So those are the initial thing. The initial symptoms you feel is the pain, the epigastric pain. Then we also have feeling of bloating or feeling of fullness, belching, loss of appetite, nausea or vomiting. All of this, after feeling this pain, would indicate that you may have ulcer. Then critical symptoms, when to know that this ulcer is now becoming a very complicated one, is when you begin to vomit blood, which may look like coffee grounds. Then there's weight loss, and there's dark or black stools, which indicates that there is bleeding going on in the stomach. So the ulcer is now bleeding, which will require surgery. So complications of ulcer include bleeding, perforation, penetration, gastric outlet obstruction, and malignancy. Bleeding in the sense that you are either vomiting blood or you are spilling blood. That means that the ulcer has opened up through that mucosal layer. It has gone deeper and now it's bleeding. It has touched the blood vessels in the stomach, and then the patient will now be bleeding. Perforation means it has perforated through that mucosal layer and can also come with bleeding and serious epigastric pain. Penetration means that it has opened through the entire thickness of the mucosa and it has entered another organ. So it has penetrated into another organ and now it's affecting the organs around the stomach, which also could lead to very serious pain and sometimes peritonitis. Gastric outlet obstruction, this means that the ulcer has now thickened. So chronic, when the ulcer has been there for a very long time, it heals. And when this is healing, it's healing with fibrosis, and somehow it narrows the canal that food passes through the stomach into the intestine. It narrows it and then blocks it. So when you eat food, it enters there, but the food cannot enter your small intestine. So you begin to throw up. So that's where you now have an obstruction. So food cannot pass through. Food enters your mouth, enters your stomach, but doesn't leave your stomach because there's no opening for it to pass through. That opening is now blocked. And then rarely, but it does cause malignancy. So it can also lead to cancer. So when the ulcer goes untreated for a very long period of time, or it has given signs and the patient is not or is not taking these notes and going to see their doctor or their GP, then it can actually lead to malignancy. So let's talk about the prevention and management. So first of all, in prevention, we're going to talk about lifestyle modifications. So there are things you can do to avoid ulcer and things you can do to avoid your ulcer when you now have ulcer, to avoid it from getting to the very critical points. There are things you can do. So firstly, you avoid NSAIDs. If you don't even want to have ulcer at all, it would be good to avoid NSAIDs. Stop smoking. So if you're a patient that smokes, you will need to stop smoking because smoking aggravates an already existing ulcer. It worsens it. Limit or eliminate alcohol. Alcohol worsens ulcer. To reduce caffeine intake, it also worsens ulcer. Eat regular small meals. So instead of eating a large sum of food at a time, it will be better for you to portion control and eat, but eat regularly. So you eat small meals, but you eat more often. So you can end up eating about 5 times a day, but in small portions, small bits, so that you don't worsen the ulcer. Avoid trigger foods such as spicy foods and fried foods. So this happens for different people. There are spicy foods and there are fried foods. So some people are triggered by spicy food. So people that have ulcer, some people that have ulcer, when they eat spicy food, it triggers their ulcer and they start having that ulcer pain and all the symptoms of ulcer. So it starts coming back. And for some people, it is fried foods that actually triggers the ulcer. Then complete prescribed medications. This, a lot of people default. So when you have been diagnosed of ulcer, after a test has been done and the person has been diagnosed of ulcer, and there are medications that are given to be completed after 14 days, it is always good not to miss any of those medications because they include antibiotics, things to stop medications, acid that worsens the ulcer in the stomach, and also something to lubricate the walls of the internal mucosa of the stomach. So those 3 medications are medications they give ulcer patients, newly diagnosed ulcer patients. And if you don't take those medications for 14 days, your ulcer would most likely not go and you would leave it and you might feel like you skipped some of those days and you feel like the ulcer has gone. Unfortunately, it has not. And it will come back and resurface after a few weeks or a few months. And then you feel the medications did not work. It was because the person did not take it as prescribed. So medications and treatment options. We have proton pump inhibitors. This is your typical omeprazole, pantoprazole, esomeprazole, and lansoprazole. So people that do have ulcer, you would know that the doctor would always prescribe this. This medication is to stop the gastric acid secretion because the gastric acid worsens ulcer and it is always produced by the body once you get hungry or once you eat food. So once you take this, you're supposed to take it 20 minutes before food so that it stops the acid secretion when you eat. So therefore, once you eat food, acid is not produced as before. Then we have H2 receptor agonists rather. These are ranitidine, famotidine. We don't really use these medications at the moment. They are limited, so we don't use these medications for now. We also have antacids. Antacids are the normal, like Gestid syrup, Gascol, all those syrup fluids that are given to ulcer patients. This medication is to lubricate the mucosa. So you already have an ulcer and you want to use something to lubricate it so that the acid does not touch that ulcer to worsen it. That is where this medication comes in. So you have to take it 3 times a day, with or without food. It helps and reduces the pain. So it's more like lubricating the injury that you have in your stomach so that you don't feel the pain as much. Then we also have mucosal protective agents. So these ones are they are sometimes in medications like misoprostol and all that. They are in some medications for ulcer patients. So if you want to take maybe a pain relief, sometimes these medications are incorporated inside those pain relief medications for people that have ulcer, just coat the lining of the mucosa. And misoprostol especially is contraindicated in pregnancy because in as much as it serves as some form of coating for the mucosa, it also causes contractions of the uterus. So pregnant women cannot take this medication. We also have H. pylori eradication therapy. So if you went to see your doctor and you complained of all these symptoms, the earlier symptoms I must have listed, they would always tell you to do a H. pylori test just to show if your ulcer is caused by H. pylori or not. If it comes out positive, these are the antibiotics you'll be given. You'll be given either triple therapy or quadruple therapy. And the triple therapy includes the omeprazole, clarithromycin, amoxicillin, and or metronidazole. So these medications are the medications you're supposed to take from 7 to 14 days as prescribed by the doctor, and you must not miss any day to better your chances of eradicating the H. pylori infection. Another medication or treatment option would be to discontinue or replace NSAIDs. So if you have chronic pain, for some people that are also battling with maybe some back pain, lower back pain and all that, and they take NSAIDs a lot, you might have to replace the NSAIDs you take with another pain relief that is also very useful in helping to eradicate your back pain and all that, but it must not be an NSAID. So we can give selective COX-2 inhibitors, which are Cerebrex. You can also see it as Celecoxib, Cerebrex. Those medications come as 200 milligrams morning and night. So they can solve any other pain that you're feeling, including your ulcer pain, but they do not cause ulcer. So you can replace your NSAIDs with Cerebrex. Now, after all of this must have happened, surgery is another treatment option. So we've talked about medications. Now we are talking about surgery. Surgery is only needed if there is perforation, which is a complication of the ulcer, uncontrolled bleeding. So that means you have to go into the stomach and ligate the vessel or stop the vessel, which is from bleeding, which is a surgical procedure. You can also, in cases where the patient has gastric outlet obstruction, which I explained is like an obstruction in the stomach where food does not go into the small intestine from the stomach, that would also need surgery to open up because that can cause constipation and vomiting. And also non-healing ulcers despite medical therapy. So despite medical therapy that you are taking all the medications as prescribed, and your ulcer has not still gone and is still disturbing you and has now started giving you different complications, then surgery is an option. So now moving to the dietary considerations, and I differentiated them into foods to avoid and ulcer-friendly foods. So foods to avoid: spicy foods such as pepper, chili, hot sauces. For some people, this trigger ulcer, but you don't know if this triggers your ulcers and you don't want to try it out. So it's always best to avoid it completely instead of trying it and seeing for yourself. Just avoid it completely if you do have ulcer. Caffeinated or acidic drinks: Coke, coffee, citrus juices, carbonated drinks, and energy drinks all worsen ulcer. So you don't want to take any drinks that contain caffeine. Also, alcohol. If you used to be a chronic alcohol user, when you have ulcer, when you have been diagnosed with ulcer, it's always best to avoid ulcer or to avoid the alcohol or completely stop alcohol because you don't want to worsen the ulcer where it will now become a complicated ulcer that needs surgery. So this can help you prevent surgery as an option in ulcer. Chocolates. And chocolate is because they contain caffeine. So you can take them in moderate quantity, very moderate quantity, instead of eating so much chocolate or foods that have chocolate content. Processed and salty foods, Indomie. A lot of people take Indomie when they have ulcer and they are not aware that Indomie, because of the spice in Indomie, it contains a high amount of salt inside, which can trigger the ulcer and worsen it. So we also have ulcer-friendly foods. So foods that are recommended during ulcer are bananas, apples, melons, as opposed to taking oranges and citrus fruits like kiwi and the rest. Those, because of their acidic content, they worsen ulcer. But bananas, apples, and melons do not have that acidic content, so they are very good for ulcers. Oatmeal and whole grains is very good. So like wheat, rice, all of that. Lean protein like chicken, turkey, tofu for the people that are vegetarians, and beans. These are very good sources of protein in people that have ulcer, and they are very ulcer friendly. Cooked vegetables like carrots, spinach, and broccoli. It's also good for us to eat vegetables when you have ulcer, and limit the amount of salt you put in these vegetables or the amount of salt you use to wash the vegetables so that you don't also worsen the ulcer. Yogurt with probiotics. So you can have more often yogurt or milk, liquid milk, evaporated milk, you can drink that, and yogurts. They also help because those help to lubricate the mucosa of the stomach and help to limit your ulcer from getting worse. Then ginger and turmeric. So you can add that in your foods, it should also be one of your spices that you use in your foods because it's very friendly with ulcer. Then recommended dietary habits. It's always good, like I said earlier, to eat small, frequent meals. So you eat small portions, but you can eat it more often. So you can eat every 3 to 4 hours, but very, very small amount of food so that you don't aggravate the ulcer or the amount, because every time you eat, the stomach is going to produce acid. And remember, we want to reduce the amount of acid that's being produced in the stomach. So you don't want to eat too much at a time. You want to eat very little while taking the medications that prevent acid from being produced, which is the omeprazole. So also, it is good to eat slowly and chew well. So the more you swallow, there are some people that do swallow food without chewing. If you swallow large amounts of food, your stomach is going to produce more acid to sort of like turn that food into chyme, because you're supposed to chew your food to make it easy to digest by your body. But when you don't chew and you swallow whole like that, that means your body has to do the work to turn that into a food that can be digested. And you need more gastric acid to do that. So it's always good to eat slowly and chew your foods well before swallowing. You also need to avoid eating late at night. Your last meal should be 2 to 3 hours before bed so that you don't aggravate the ulcer. It's always good to stay hydrated. Incorporate the ulcer-friendly foods that I mentioned earlier to your meals. Limit or avoid ulcer-aggravating foods. So it's either you limit it or you stop it completely. I would recommend you stop them completely or just limit them. So for aggravating foods like pepper and the rest, you can limit the amount of pepper you put in, but not necessarily. But for smoking alcohol, stop it completely and end NSAID use. Then avoid smoking. So smoking worsens ulcer. So if it's something you were doing before and you're now diagnosed with ulcer, you need to stop it. So there are different myths. I wrote about 7 common myths that a lot of people might think of ulcer, and I would want to debunk those myths. So the first one is spicy foods cause ulcer. No, spicy foods do not cause ulcer. They worsen ulcer. They can irritate the existing ulcers, but it does not cause them. The main culprits of ulcer is the H. pylori and long-term NSAID use, like ibuprofen or aspirin. 2, the second myth, caffeine and stress are major causes of ulcer. They are not major causes of ulcer. Stress could cause ulcer, like the physiologic stress I mentioned, but it is not the major cause of ulcer. They are lesser causes of ulcer. So the major causes remain Helicobacter pylori infection and the use of NSAIDs over a long period of time. Number 3, you can't have an ulcer if you don't take NSAID. Wrong. You can have an ulcer. So if you're somebody that doesn't take NSAID, and now somebody tells you, a doctor, you go to meet a doctor and they tell you that you have ulcer, and you're arguing with the doctor that it's not possible because you take helicobacter infection, which is different. For if you eat that, you can get ulcer from the infection do cause it. So even if you don't take NSAIDs, there are other ways to get ulcer, which is the Helicobacter pylori infection. People with ulcers should fast or avoid eating. I know somebody that thought about this and she said she stopped eating because she had ulcer. So she felt every time she eats, it would no. You shouldn't fast or avoid eating when you have ulcer. You should eat, but frequent meals. It's better than eating a large sum of food at the same time. Okay. The 5th myth is H. pylori is rare and not a serious issue. No, H. pylori is not rare. In fact, it is indeed very common. So a lot of people do have H. pylori infections and they have not yet come down with ulcer. So yes, it's actually very common. If you test people, you would see that a lot of people actually do have H. pylori infection. The only thing is some of them have not come down with ulcer, and that's why they assume that it is rare, but it is not, and it's actually a very serious issue if left untreated. The 6th myth, you do not always need surgery. Like I said, if you do not treat the ulcer when you notice it on time, yes, it could lead to complications that might need surgery, but not all the time. So if you catch your ulcer early and you treat it and you take the medications as prescribed by your doctor, yes, your ulcer can heal. Okay, it will take time, but it can heal. But surgery is not always the solution. The seventh myth is alcohol causes ulcers. Earlier again, I said alcohol does not cause ulcers, but it worsens ulcers. So you might have a small ulcer in your stomach and you're not
Hello,
even
Dr.
aware
Chika.
of it yet.
Hello, doctor.
I mean, yes, hello.
Yeah, okay. Please,
Yes, I can hear you.
some people are complaining that you're not audible. I don't know, maybe it's the network or maybe it's your speaker. I don't know. But there are some complaints on the chat box that you're not audible. So please kindly, maybe, you
All
know.
right. Okay, so maybe it's the network.
Okay.
Let me see if I
All
can
right.
just
You can go
restart the
ahead. Thank
laptop a
you.
little.
Is quite bad. Yes, we'll send the soft copy to the retirees platform. Oh, I think she's even gone off the call. We've lost her. Maybe she'll join us later. Yes. So once again, the topic she was talking about is understanding peptic ulcer disease. And she mentioned that peptic ulcer is an open sore that develops in the stomach, in the tummy, yes, the upper part of the small intestine. And this is caused by stomach acid and digestive enzymes. She told us the types of peptic ulcers. She said gastric ulcer, which occurs in the stomach lining, duodenal ulcer, which occurs in the upper part of the small
Point
intestine.
of
Oh, okay, you're back. She's gone off again. Hello, doctor. Okay, let's go on. The types of ulcer, yes. Gastric, duodenal, and esophageal ulcer. This occurs in the esophagus, yes, which is due to acid reflux. Then she talked about the causes, which include smoking, alcohol consumption, excessive stomach acid due to some certain foods that we eat and some drugs that are taken. Then she talked about the symptoms. So people that have peptic
Hello?
ulcer have,
Okay.
okay, doctor.
Yes, ma. I'm back.
Okay,
I had to log in with
okay,
another
no problem.
device. So
All right, no problem. Okay, it's better now anyway.
okay, it's better
It's
now, right?
louder, yeah, louder.
Okay, let me
Yes,
try
yes,
to
please go
share
on.
the screen. Okay. Let me try to share my screen so I can finish.
All right, no problem. Okay, so while she's trying to share the screen, the symptoms she mentioned, she said the person would have burning stomach pain, um, bloating, nausea, and weight loss. Then she talked about the treatment, like they could take antibiotics. Okay, doctor, are you ready? No. For the treatment, you take antibiotics, antacids, and you have to change your
I'm
lifestyle.
still trying to get it.
Okay.
I'll
So
be
you have to stop taking alcohol, spicy foods, and also smoking. Um,
Can you?
yes, we can.
Hello.
Yes, we can. You can go on. Dr. Chika, you can go on, please.
Okay, this is ulcer. Yes, I've started. Hello?
Yes, yes.
Okay. Okay. So I was on alcohol causes ulcers, and I said, and I mentioned that alcohol does not cause ulcers. It only worsens the ulcers. It doesn't cause the ulcers at all, but it worsens it. And the last one was once
Oh,
ulcers
okay.
are treated, they don't come back. Ulcers do come back even after they are treated. Sometimes they do come back, especially if you did not stay away from NSAIDs or avoid the things that aggravate ulcer, then it would always come back. So that was the end of my presentation. Thank you very much. I've now entertained questions if there's any. Thank you.
All right. Thank you, Doctor. Yes, you have questions already. Okay, everyone, we are now in our question and answer sessions. You can put your questions in the chat box. Some questions are there
Thank you,
already, so
ma'am.
I'll just see. Then you can also raise your hand, please, and we'll
Okay.
call on you. Someone is asking, was NSAIDs, NSAIDs?
Okay. Okay. Thank you very much. So NSAIDs is an acronym for non-steroidal anti-inflammatory drugs, and they include ibuprofen, diclofenac, those medications, especially those two, which a lot of people take, they are NSAIDs. So those two medications, especially, are medications that are very often sold over the counter. So you have back pain, you just go to the pharmacy, and the next thing they're giving you ibuprofen. So when you abuse those medications, also including aspirin, you abuse those medications, you can come down with an ulcer, because those medications, what they do is that they eat up the mucosal layer, which is the protective layer of the stomach. And by the time they eat it off, they erode that part and now form a small opening, which is a sore. And then when that sore begins to pain you, you now start feeling the symptoms of ulcer. And that is another way ulcer can be gotten.
Okay, thank you. Madam Olajumoke Adesomi. All right, good
Good
morning.
good morning. Good morning, doctor.
Good
And
morning,
thanks so
ma'am.
much for this. Thanks so much for this topic or the program. I really appreciate your effort on it. I want to ask these questions on this peptic ulcer. I normally go for my comprehensive test every year. I went last year and the results came out, and I presented the results to my doctor, and she looked through it and discovered that my H. pylori was positive. So he now placed me on the Omesha Plus kit, 3 tablets twice daily for 2 weeks. I took it, that was last year, 2024. I took it, and for that 2 weeks, and I didn't feel anything. I didn't even know that I have anything like that. So this year, I went for my comprehensive test, and they still discover H. pylori. They said H. pylori was positive. So I saw the doctor at the lab. The doctor now told me, at times, it used to occur like that it may not be that they are, the test is not truly tell you that you are your H. pylori is positive. Now, I now went back to my doctor. That doctor now told me to go and do stool H. pylori, stool H. pylori. So I now took my stool sample to the lab again. Then they did it, and they discovered that H. pylori was negative. So I went back to the doctor to present the result. He said at times their machine or something used to say is positive. Maybe it's the blood they test or something. That if I go with my stool, they now test the stool and the stool was negative. So that is the one I want to confirm. That doesn't mean I don't have that peptic ulcer.
Okay. Thank you very much, Ma, for that. So yes,
Okay.
it's true that sometimes stool is actually the most accurate
Okay.
stool H. pylori test is actually the most accurate. So if a blood test is saying negative, you can always confirm with a stool test. And even if the stool test tells you negative, remember that a sore in the stomach is the peptic ulcer, right? So even if the bacteria has gone, the bacteria has already caused
Okay.
an injury that has not yet healed. So we
Okay.
don't know the healing time for everybody because different
Okay.
people heal at different times. So it is possible
Okay.
that you might still have the sore in your stomach, but the infection is gone. So because that sore is still in your stomach, you still need to avoid it. You will stop taking NSAIDs. You will still not take NSAIDs. You will not take foods that will worsen ulcer because you are not sure that the sore has completely healed. And you don't know how long it will take for the
Yeah.
sore to heal. So we need to wait for that injury. The only way you can
Okay.
know is if you do an endoscopy. So with an endoscopy, you
Okay.
can visualize your stomach maybe after a few years of avoiding all of this, and you go for an endoscopy, and they do the endoscopy and they visualize your stomach and they will check if there's any sore. If they don't see any sore, that means your ulcer has completely gone. But doesn't mean that you should now still take the things that would aggravate ulcer or NSAIDs,
Okay.
but it means your
Okay.
ulcer has gone. So an endoscopy is a confirmatory test to know if that sore has completely healed. But pending the time you do
Okay.
the endoscopy, we are not sure how long it takes to heal. So after taking your medication, even if it says negative, that means the bacteria is no longer in your system, but the injury is still there. So you
Okay.
still have to maintain and avoid all those bad foods that ulcer does not like, just to make sure that the sore has healed completely. And then you can now do
Okay.
an endoscopy to confirm.
Okay. Okay.
Yes,
Thank you
ma'am.
very much.
You're welcome,
Thank
ma'am.
you.
Thank you, ma'am. Someone is asking, I know you mentioned ginger. So I'd like to know, is ginger good or bad? As in the intake of ginger.
Okay, so ginger and garlic is good, but in moderate quantity, because some people might take ginger shots and those early morning shots of ginger shots, and if it is in very high amounts, it could actually also aggravate ulcer. But when you put small bits of ginger in your food, you use it to cook your food, yes, that is good and healthy. So ginger, garlic in your food is good and healthy, is good food. But drinking ginger, lots of ginger directly, is not good. But you can make ginger tea. Ginger tea, maybe one small, you slice one small part of ginger, boil tea, boil hot water and pour it inside. You can drink that. But when you blend the ginger and it's very concentrated, it's not also good, especially on an empty stomach for somebody that has ulcer.
Okay.
And
All right. Thank
yes,
you.
yes, all right.
Is it genetics? As in, can it be inherited? Does it pass from one generation to the other?
Sorry, I didn't get that.
Is it genetical? As in, can it be passed from father to mother, to child, child to mother to child, and things like that?
Yes, so yes, like I earlier mentioned, that ulcer can be inherited. So when you have it's not for everybody, but when you have family relatives that have ulcer, you have a tendency to have ulcer too. That's just the whole thing. So if you have a relative or a family member that has ulcer, especially immediate family members, so I'm talking about your parents, your mom, your dad, they have ulcer, any history of ulcer, yes, you have a higher tendency to have ulcer than any other person that is not related to somebody that has ulcer.
So yes.
Okay. Is it good to eat fruits on an empty stomach?
So yes, you can eat fruits. Like I mentioned apples, watermelon, and all those other type of fruits. Yes, but you cannot eat acidic fruits, which are citrus fruits. So pineapple, oranges, kiwi, all those type of fruits, you don't eat it on an empty stomach. And those are fruits to avoid in ulcer. So, but you can eat pawpaw, watermelon, and other types of fruits, bananas, apples on an empty stomach. Yes, you can. It helps with digestion. But citrus fruits, do not eat citrus fruits, especially on an empty stomach.
Okay.
Yes.
I don't know if this person is a Mr. or a Mrs. Shonu BS. Yes, I mentioned earlier that we'll post the soft copy on the retirees platform, but you said you are not retired. So if you don't mind dropping your number on dropping it in the chat box, so I'll send it to you because I don't know which of the platforms you are on. So please kindly drop your number so I'll send it to you on WhatsApp. Okay. Another question for you, doctor. Is surgery the last option for complications? Is surgery the last option for complications involving bleeding?
Hello? Yes. Thank you for the question. Yes, surgery is actually the last option. That is the last option. Then if you do some, there are different types of surgeries. So you can do one surgery and then they tell you, oh, okay, this did not solve it. So we're going to do another type of surgery. And so you just keep doing different types of surgery until it has been completely eradicated. So it's actually the last option.
Okay. All right. I know you've talked about
Yes.
apple intake, but this person would like you to expatiate more on apple intake.
Okay, so apple is not acidic. It's not
It's
acidic.
not
It's
it's
not
not
acidic.
acidic.
Yes,
Okay.
apple is not acidic. So yes, you can take apple. It's an ulcer-friendly food. It's good for ulcer patients. It's not bad at all. So yes, you
Okay.
can take apples.
Um, when one experiences pain after feeling very hungry, but gets better when food is taken and hunger is avoided for the most part thereafter. Oh, okay. When you're hungry and food is taken and there is no more pain for a long time to come, can we conclude this is ulcer? Um, Doctor, do you understand that question?
No, I don't. Can you repeat the question?
When one experiences pain after feeling hungry, but the pain gets
Okay.
better when food is taken, and hunger is avoided for the most part thereafter, and there is no more pain for a long time to come. Can you conclude that this is ulcer?
So that's when you have pain and you have pain. Once you eat, it gets better, and then you avoid eating, and there's no pain after. You can't conclude that's ulcer. You can only say you have ulcer when you have been diagnosed of ulcer, you have done the appropriate test, and you have seen. And if you are not a chronic NSAID user, you need to do a Helicobacter pylori blood or stool test to actually confirm that you have ulcer. So you can't feel pain, but that is a symptom of ulcer. The type of pain that you are feeling is a symptom of ulcer, but you cannot clearly state that you do have ulcer until you have been diagnosed. So you've done the test and you've known that you don't have ulcer, because there are other conditions that can mimic that type of pain. So you need to confirm what it is actually. So it might not necessarily be ulcer. It could be something else, or it could just be that you didn't eat for a very long period of time and you now have some rumbly type of pain, which is some form of discomfort. That's not necessarily ulcer. It's just your body telling you that you need to put something in your stomach. Much pain before you eat, and you need to confirm if you have ulcer. You can get the test done and then see your GP to either interpret the results for you, see if it's positive or negative, and they give you medications. Then you avoid foods that would aggravate or worsen the ulcer. So it's not necessarily ulcer, but it could be. But you have to be confirmed that it's ulcer. You have to confirm it.
Okay, all right, thank you.
Did I answer that?
Does it help? Does it help when you take alkaline water? Does it help when? Hello, doctor. Let's keep going now. Dr. Chika. Okay. Dr. Chika. All right.
Sorry about that. I had some issues connecting. Okay, sorry. So the question you said, does it help? Hello?
If you take alkaline water.
When you have ulcer, or is the person asking if it prevents ulcer or when you
Okay,
have
well,
ulcer?
the person did not specify, but the question is, does it help when our body is alkalized? That is taking alkaline water. Maybe she's asking
Yes.
if you take alkaline water, you might not get
Hello?
ulcer. Did you get
Ulcer.
that?
Okay, well,
Yeah.
yes, I understand the question. Well, alkaline water, because the stomach content is acidic, obviously. So you take alkaline water, it neutralizes the stomach acid, thereby reducing the effect of the stomach acid on the stomach. So yes, it could actually help with some form of help in patients that do have ulcer. But if you don't have ulcer, it doesn't really mean anything, just neutralizing the stomach. So, but if you have ulcer, yes, that can help.
Okay.
Yeah.
All right. Another one. Oh, I think this person has ulcer. She said it was discovered due to I don't know the ailment, high I don't know,
H. pylori.
hypothermia.
H.
Okay.
pylori. So that's the
Okay,
infection.
H. pylori. Oh, okay. H. pylori. Okay. I have taken the medication prescribed, and the doctor asked me to come back after 90 days, even though still on some medication. So is it necessary to go back? Because the endoscopy test is very expensive.
Oh, well, yes. To actually confirm, it's necessary to go back to actually confirm if you still have the ulcer or not. But if it is expensive and you cannot afford to go back yet, you can just keep taking your medications and avoid anything that would aggravate the ulcer, worsen the ulcer. Continue taking your PPIs, that's your omeprazole, and those gestid gas cough syrups. Those help with lubricating the stomach and making the ulcers heal better and faster. But if you don't have the money to do the endoscopy yet, you can just continue the medications and do that, pending when you have it. But if you have the money, yes, it's very important to do it so that you are aware that it has gone completely, so that you can stop the medications, because you need to confirm before you stop the medications.
Okay, all right, thank you. Is there a permanent treatment for ulcer?
Sorry, is there
Is there a
a
permanent, everlasting treatment for ulcer? Is there a permanent treatment for ulcer? Maybe after the surgery, it still comes back or something. Is there a permanent treatment?
Well, not necessarily. The permanent treatment might be to take out the stomach, which is not very necessary in some situations. You don't need to take out the stomach. So it's something that can just be managed. You can just manage it, but there's no like definitive treatments like, oh, when I do this, my ulcer will disappear. Except you take out the stomach, and that's not very necessary in many situations. But there are some surgeries that would cut out part of that part of your stomach and then join it back with the other parts. And that's it. But that doesn't mean that another part of your stomach cannot now develop the ulcer later. So it's no permanent treatments managed.
Okay, so I think you've even answered the next question, which is how many years can one be
Okay.
finally free from ulcer? So I don't know.
So okay, so in that one, if you've been diagnosed of ulcer, you have taken the medications judiciously, you have done everything the doctor has said, you have given the ulcer time to heal, and you have gone back for an endoscopy, and there's no ulcer, then you are good. But that doesn't mean that now that there's no ulcer, you should now go back to the things that do cause ulcer and take them. So some people are actually cured from ulcer. Once you do an endoscopy and they check your stomach and they don't see any ulcer, then you don't have ulcer anymore. But that doesn't mean that when you go to the hospital and they give you, you don't tell them that, oh, I have ulcer or I had ulcer. You can, if you've been cleared of ulcer, you can always tell the doctor that I did have ulcer some years ago, and we will not prescribe NSAIDs to you, because if you've had ulcer before, if you take NSAIDs, there's a possibility it can always still come back. So even if you've been cleared from ulcer, it's still good to avoid anything that will cause or trigger ulcer so that it doesn't come back.
Okay.
Hello?
All right. So taking
Yes.
green tea, what about taking green tea? Is it okay?
Yeah, green tea is fine. Green tea is okay. You can drink green tea. It doesn't affect ulcer patients.
Okay. All right. Can an ulcer patient eat eba or gari?
Yes, and ulcer patients can eat eba, Gary. You can eat swallow, you can eat carbohydrates, yes. But your soups should not be too spicy. Now, when we are talking about spicy, we don't necessarily mean just pepper, salt, Maggi. If the Maggi content is too much, or the salt content is too much, or the pepper content is too much in the soup, yes, it would aggravate the ulcer. But if your soup is not spicy, it doesn't have too much pepper or Maggi, then you're fine. You can have swallow. You can eat very well.
Okay, someone is asking if ulcer pain can cause back pain.
Yes. Yes, it can. So, like I said, I mentioned it as part of the symptoms. When you have the epigastric pain, sometimes the pain can go to your back, it can go to your shoulder, and it can also migrate to your chest. So, you can feel, if you have ulcer pain, you can feel some type of pain in your chest, in your epigastric region. The pain can be moving to the tip of your shoulder or your upper back. But
Okay,
just
is there
back
any natural?
pain.
Oh, sorry.
Sorry. Yeah, go on. Go
Go
on.
ahead, please.
Okay, so but there's no, if you have only back pain, an isolated back pain, you can't say that is an ulcer pain because it's just an isolated back pain. So it could just be a musculoskeletal pain or maybe your sleeping position or whatever that must have caused your back pain. But if it is just an isolated back pain, the pain is not coming from your epigastric region, it's not coming from your chest, it's not going to the tip of your shoulder. You just have this severe pain at your upper back, then we might be looking at other things, even though ulcer would still be a differential of that, but it could still be something else. Hello?
Okay, yeah. Someone is asking if what the natural remedy for ulcer is. Is there any natural remedy for ulcer?
No, 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 no. There's no natural remedy for ulcer that you say, oh, this is what I take and the ulcer will go. But if you're good with, if you're eating those fruits and all that, you're avoiding all that, like I said, the ulcer will most likely just heal on its own. So far, there's nothing triggering it to worsen. Your ulcer should heal fine, and then that's it. So, but for natural remedies, there's really no natural remedy. Like I said, it's just something that is managed. So you avoid, you do the do's and don'ts of ulcer, and you're good to go. Your ulcer should heal just fine.
At the time rate. Okay, yeah, I just want to inform everyone that you can go to YouTube to listen to this session. Okay. The link has been sent to the chat box, so you can just click on it and watch it to watch this particular session and other sessions that we've had. There are many topics that we've covered for a while, so you can just go to our YouTube link and you'll see all our sessions. Okay, someone is saying, oh, okay, should coffee be avoided? I think she said that we should not take it. Doctor, please take that. Does it mean that coffee should be avoided?
Yes, because anything that contains caffeine is a component, is something that is contained in coffee. So yes, coffee should be avoided. Also chocolates, like I said, because caffeine is in chocolates, caffeine is in Coke, caffeine is in energy drinks. So anything that has caffeine should be avoided. Coffee is part of that.
Okay.
Yes.
Okay, all right. Just checking to see if we have more
That's fine.
questions.
Mm.
Well, this has been very educative and enlightening. Thank you so very much.
Thank you very much, ma. Thank
Okay,
you.
someone is saying, does taking Zobo drink, what's the implication?
Okay, so for Zobo drink, I've heard some people say Zobo drink does cause ulcer, but in my opinion, Zobo drink might aggravate ulcer taken on an empty stomach. So it will be better.
Can you take that again?
Yes, I said Zobo drink might aggravate ulcer if taken on an empty stomach. So even if you want to take Zobo, you can take it after a meal, after you have eaten.
Oh, okay.
That's if you have ulcer, yes. But if you
Oh,
don't have
if you
ulcer,
have ulcer.
yes, if you have ulcer. If you don't have ulcer, you can take Zobo drinks. It doesn't cause ulcer.
Oh, okay.
Yeah.
Okay, all right. Thank you.
All right.
Do we have any more questions, please?
Hey, I'm seeing
don't
something
think
about decaf coffee.
Okay,
Yes,
yeah.
still avoid decaf coffee. Because some
So
people
any
think that
kind of
yes,
coffee.
decaffeinated coffee means that yeah, still avoid it because even the decaf coffees, some people still say it contains some minimum amount of caffeine, even though they said it's decaffeinated. It's just like Diet Coke and the rest that they say does not contain sugar, no sugar, but it still contains sugar. I mean, it's still sweet. So decaffeinated coffee might still contain some form of caffeine inside it, even if the quantity is very little. So you still need to avoid decaffeinated coffee. That's for people that have ulcer already. If you don't have ulcer, you can take coffee. It would not cause ulcer. Caffeine does not cause ulcer, but worsens ulcer. So if you have ulcer, just avoid it.
Okay, so apart from the link that was sent, because I know by the time we end this call, the link will disappear. We won't see it anymore. So I'll just call it out. It's www.youtube.com/@PS Retirees Cooperative MS. It's been pasted already, but I'm just calling it out in case some people don't see it. www.youtube.com/@PS Retirees Cooperative MS. So that's where you'll see all sessions, like I said earlier, previous ones. Yeah. All right, thank you very much. Okay, someone said I don't know if it's a he or a she, that was just diagnosed of ulcer last week. Oh, sorry about that. So I'm very sure you got more enlightenment from this topic. Yes. All right. Okay, thank you. Dr. Chika, thank you very much. So I'd like to call on our director.
Thank you very much, Ma. Thank you, everyone. Thank you so much for having me.
Yeah, but please still hold on. Please still
Okay, that's fine. I'm still here.
Okay. Hello, ma. Okay, ma.
So
Please,
once
let's say
again,
some few. All right.
yes, thank you very much. I think we had a very, very robust conversation on peptic ulcer, and I want to believe that we've both been well educated. Like I mentioned, there's a go back, refresh memory, and get all the information that is required for you to manage that condition if you have it, and to ensure that you prevent it. So thank you very much, Dr. Chika Hamzat.
Thank you very much, Ma.
That's a very good one. I think that is all on this session. We want somebody to specially appreciate Dr. Chika. I believe she did a very good job. She did justice to that topic. Can somebody please, on behalf of the head of service, the permanent secretary, the entire team of post-service department, and even the retirees, appreciate Dr. Chika? Somebody to signify. And please, Mrs. Roland, you can change the setting. You can change the setting. So allow everyone to unmute.
All right, ma.
Okay, so Dr. Alao, please can you, since nobody is signifying, let me call
Yes,
Dr.
okay.
Alao. All right.
Thank you. Good morning, everyone.
Good morning, sir.
But before I give the vote of thanks, I want to say that the Bible has said it, that my people die for lack of knowledge or information. I want to specially thank the post-service department of the government service for not wanting anyone to die by giving us adequate knowledge. And I pray that as we get all these things every other week, the Lord will help us to make the best use of it. And in fairness, we want to thank God that the Lord is retaining the life of many of us retirees. I believe this workshop you are giving all the time, this knowledge you are giving us all the time must have been part of what is sustaining us. On that note, I want to specially thank our dear Dr. Hamzat, for this enlightening and well-prepared message, and prepared for adults like us. The Lord will continue to bless her.
Amen.
And whatsoever she lays her hands upon, they will always continue to become successful. Most especially our dear sister Duro Dola, the mother of all retirees. Please continue the way you are taking care of us. And to everyone who spare time to even participate in this program, please, thank you very much. And let us try as much as possible to make the best use of all the information dished out. Once again, thank you very much. And we thank God for sparing our life and giving us the opportunity to listen to this. So thank you very much.
Thank you very much, sir. Thank you. Much appreciated. Yes, we've come to the end of today's session. We appreciate your presence. We thank you for always joining the call anytime we post the link. Thank you, thank you, thank you. So we can all please unmute ourselves and say hello to one another as we usually do. Thank you. Good morning, everyone. Please unmute yourselves and your videos. Thank you. Oh, am I supposed to? Good morning, good morning. I don't think I can hear anybody.
Good morning, good morning.
Okay.
Thank you very much for this beautiful presentation. We hope it will continue with us, especially for elderly ones. The BSO, especially the Almighty Allah continue to be people,
No,
give you the
I've access to
necessary
mute
knowledge
themselves.
and wisdom to continue. Thank you.
Is not. I'm just sending them some.
Thank
Okay,
you.
hey, you just unmuted us now. Now we can speak.
Exactly. We have just been unmuted.
Yeah. I'm so sorry. I think it was network. I think it was network. I had unmuted from my end. But no, I'm sorry about that.
All right, no problem.
So thank you very much for joining, but maybe we are all still under duvet. I cannot see, I can hardly see any face. Our cameras are not on. Okay, I can see Mr. Akeushola. Good morning, sir. Good to have you. Mrs. Oguntuwase Karoma. Thank you very much for joining us, ma. Oh, Mrs. Odeneye. Ẹ tún pa camera ni. Thank you. Thank you for joining. God bless you. Dr. Alao, thank you very much. Mrs. Kasali. My Yoko. Ẹ jẹ́ ká rójú yín náà.
Okay, thank you.
Okay. So we would have another session in the next 2 weeks by God's grace, and yeah, sorry about that. It was network issue again, I think, because I was trying to log in again. Yes. So we'll have another session in the next 2 weeks, having another topic that would enlighten us on something new. So I look forward to everyone joining us again, and God willing, we will all be on the call by God's grace. Dr. Chika Hamzat, thank you once again. All right, she's left. All right, everyone. Have a wonderful holiday tomorrow and a wonderful weekend.
Bye-bye.